I'm Dr. Yai Buranakul from the state of Illinois in the United States. I'm a pediatrician and now practicing more natural medicine. Several years ago when I was practicing conventional pediatrics back there, I encountered a lot of kids who had attention deficit problems and several with autism, but I had seen routinely a lot of kids who had inflammatory problems such as allergies, asthma, and eczema. And if I knew about gut health back then, I could have helped a lot, but I felt quite frustrated about not being able to help, especially the severe cases, very well. So there has been an explosion of knowledge recently about the gut microbiome and its relation to human health. And several groups around the world have found direct links to autism. So I'm going to try to share with you what I know so that you can bring it to help kids with autism. Okay. Let's see. So the microbiome is basically, it's a community of bacteria and microbes that live in and on the human body. The two most important areas affecting human health seems to be the oral microbiome, basically the mouth, and then the gut, especially the small intestine. About 70% of kids with autism have GI issues, and that can be a whole range of stuff, including like reflux, constipation, which I saw regularly. Like every other kid was constipated in some way, it seems like. But autistic children, I guess in particular, have GI issues. You also see colitis, allergies, bloating in kids. About a third of these kids actually have food allergies and intolerances, and that's a lot more than regular children. A very common problem that kids with autism have is like poor oral health. And so they often have gingivitis, which is inflammation of the gums. And so you may see swollen red gums that bleed easily when their teeth are brushed. They don't, generally, I've seen the kids who do not want their teeth brushed at all. They just cannot stand their teeth being brushed, so their oral health suffers. And you could see plaque all over their teeth, which are basically communities of bacteria that's stuck on their teeth. So in the gut or the small intestine especially, of children with autism, we have some general characteristics that we see, but there's a lot more differences than this. I can only give you like very general idea of what we see. We see a lot more Clostridium species of bacteria. And Clostridium, we know that it's related to a lot of human health issues, like infections like Clostridium difficile infection, colitis. They produce a lot of toxins that, if they overgrow, can basically cause a lot of issues. And they also produce like toxins such as HP, HPA, and P-cresol that have been shown to directly, actually, when it gets into the brain, can directly cause brain dysfunction. They also have elevated numbers of like candida or yeast species in their guts, which also produce toxins. And they have fewer levels or fewer amounts of beneficial bifidobacterium species, which are known to actually are anti-inflammatory and tend to help nourish the gut. So when you have dysbiosis, which is an imbalance of bacteria that cause health problems in these kids, you may see basically types of bacteria that will actually produce chemicals such as hydrogen sulfide, D-lactate, and propionic acid. When they get into the body, and they will actually get into the cells and actually damage the mitochondria, and they will cause brain dysfunction. Kids with ASD also have been found to have a less diverse gut microbiome, which means that they have less biodiversity in the bacteria in their gut compared to normal children. And this is also seen in their mouths as well. So their oral microbiome is also quite limited as compared to normal kids. And you can actually, the kids who actually have a limited, a more limited number or variety of microbiome in their gut are the ones who have also a disrupted microbiome in their, among their teeth as well. Here's some, these are not all the risk factors for autism, of course, but these are some of the ones, especially from the microbiome viewpoint. So main risk factors that could be related to that are related to the gut microbiome include the use of antibiotics during pregnancy and in the first few years of life. And if the child is formula fed, that's also raises the risk. And also prenatal exposure to medication, stress, infections, and inflammation. There are some other risk factors that may or may not involve the microbiome, but it's exposure to pesticides, maternal obesity, and maternal autoimmune diseases. So what we do know is at the bottom ones, at least, that they are inflammatory stimuli and they are oxidative stressors on the baby. It's basically causing inflammatory damage. So leaky gut, I'm not sure if you've heard, but leaky gut, many people know now that leaky gut, which is increased intestinal permeability due to inflammation in the gut, is seen in at least 37% of kids with ASD. And this allows food particles, bacterial products, and toxins into the bloodstream. A pretty well-known substance now from gram-negative bacteria is LPS, or lipopolysaccharide. And this is probably probably the most powerful inflammatory substance from these bacteria that enters our bloodstream from the leaky gut. Oops. So what I want to show from this one is that if you have LPS enter the body, it will interfere with liver detoxification enzymes, which are called the cytochrome P450 enzymes, and they will actually block it from being excreted into the stool. And therefore, what will happen is that you'll have accumulation of toxins inside the body and inside the brain. So I want to show you here that leaky gut can be contributed to by toxic buildup in the body and the brain, and also dysbiosis, which leads to inflammation throughout the body, which leads to a inflamed blood-brain barrier, which causes leakage also of metabolites and inflammatory substances into the brain. And this causes a toxic buildup in the brain, which causes brain dysfunction. You may have heard of this as well. It's small intestinal bacterial overgrowth. Basically, it's dysbiosis, whereby too much bacteria grow in the small intestine. Basically, it's like too many pathogenic bacteria overgrow the beneficial bacteria. And this, of course, causes leaky gut. And I would say probably most kids have overgrowth, but many of them have been shown to, at least 30% have been shown to have an overgrowth. The most common symptom is bloating, but you could also see nausea, vomiting, rashes, diarrhea, and asthma. So Like I said before, gingivitis is very common in these kids, so that's what we should not neglect. These kids have greater growth of pathogenic bacteria in their mouth than typical children. And it's been shown that that kids with ASD, or not just kids with ASD, but gut inflammation will actually lead to bacteria entering the brain through the nerves, such as the vagus nerve from the gut, and possibly enter the brain from like the trigeminal nerve and the olfactory nerves as well, because they're close to the mouth. But of course, they can enter through the bloodstream as well. In Alzheimer's, in Alzheimer's patients, it's been shown that that they have colonies of oral bacteria that are basically growing in their brain. And so I'd say that, you know, maybe autistic kids actually have something similar going on in their brains. They may have living bacteria growing in their brain. I know for sure they actually do, but they may actually have pathogenic oral bacteria living in their brain as well, causing further inflammation. In the United States, glyphosate, which is it's a major herbicide over there, it's very powerful. It's used in like basic production of corn and soybean crops, and basically it's in the food supply everywhere now, including the wheat supply in the United States. It's now been implicated in autism pathogenesis. Autism has grown in the United States and it continues to grow, and it's in about 1 in 45 children now in the US. And some people have connected glyphosate use. So there seems to be like a parallel between increased glyphosate use and increased autism. But I believe that it's not just that. I believe it's everything. There's just a lot of things happening all at the same time, and everything, including glyphosate, is increasing. So we're doing something wrong. Glyphosate has been found to be antimicrobial, and it selectively actually kills beneficial bacteria while leaving pathogenic bacteria to grow. So here I just want to show you a diagram. Basically, when you have dysbiosis and SIBO, they'll lead to leaky gut and leaky mouth, allowing LPS and other substances into the bloodstream, causing inflammation throughout the body, causing leaky blood-brain barrier, which causes brain inflammation, and therefore you have brain dysfunction, and it also prevents the brain from actually detoxifying very well and healing. Oh, and another thing I just want to mention is that when the brain is inflamed and excited too much, it's going to cause stress, which will actually cause dysbiosis to become worse. I just want to mention here, just so that you hear about it, that so this is another effect of dysbiosis. Certain types of dysbiosis with certain bacteria will actually lead to a special type of inflammation by Th17 cells, which are called T helper 17 cells that are related to autoimmune diseases. And this leads to an very aggressive inflammation. And so certain types of bacteria can actually do this. When you get this, you actually have fewer T regulatory cells, which are involved in anti-inflammation. So you get more widespread inflammation. Another pathway that you should hear about at least is the kynurenine pathway. The kynurenine pathway is a pathway that actually causes greater amounts of inflammation in the body, but it also causes psychotic symptoms. So I would say that there's a high likelihood that many kids with autism actually have this being overactivated in their body. And it's activated generally by inflammation and stress. And this pathway actually uses up tryptophan, which is an amino acid that's necessary to produce serotonin, the neurotransmitters, serotonin and melatonin in the brain. So this will actually interfere with neurotransmitter functioning. And it will actually decrease tryptophan. There's also certain bacteria that will digest tryptophan. Basically, they just eat up tryptophan and with dysbiosis. So if you have vitamin B6 and N-acetylcysteine, that will tend to decrease the effects of this inflammatory pathway. So this one, I just want to show you that if you have inflammatory products, they actually activate, if they can get into the brain through a leaky blood-brain barrier, they will activate the microglial cells, which are the immune cells in the brain, which activate the supporting cells of the brain, astrocytes. And they produce like neurotransmitter glutamate to excite neurons, which cause something called neuroexcitotoxicity. And that kind of feeds back to causing more microglial cell activation. So it kind of goes round and around in a circle. In the meantime, mitochondria get damaged because of basically too much excitation. And the mitochondria are the energy-producing powerhouses of the cell. So if they get damaged, then the cell has less ability to actually produce energy. And so it actually causes even more stress. So these are two neuron receptors, the NMDA receptor, which is an excitatory neural receptor, and the other one is right next to it is the GABA receptor, which is an inhibitory neuron receptor. So in ADHD and brain inflammation, you get too much excitation. So basically, the NMDA receptor is working too much. It allows calcium into the cell. And as you can see, there's actually a zinc site there and a magnesium site. If you actually have zinc in that site and magnesium in that site, it will actually help block calcium from activating the cell or depolarizing the cell. In addition, I just want to mention that glutamate activates this receptor. So if you can actually reduce the amount of glutamate in the brain, that would help. And one way to do it is actually to convert glutamate into GABA. You could basically utilizing an enzyme that requires vitamin B6. So if you have vitamin B6, zinc, and magnesium can help with excitation. Some symptoms of brain excitation or overexcitation include depression, anxiety, increased pain, insomnia, and dementia symptoms. Basically, they can't remember and they can't pay attention and so forth. So how else does dysbiosis affect the gut and the brain? First of all, what happens is that if you have dysbiosis, it will actually prevent the vagus nerve from calming down the inflammation in the gut. Because normally, with good bacteria in the gut, the vagus nerve actually acts to decrease inflammation in the gut. But dysbiosis gets rid of that. And also, with too much overgrowth of bacteria, you get poor digestion. You cannot absorb nutrients as well. And also, if you have leaky gut, what happens is that there are neurotransmitters that are produced by bacteria in the gut. And that can actually get into the bloodstream and into the brain. And so it can cause brain dysfunction by itself. Oops. And like I said, oxidative stress, I mentioned oxidative stress. Oxidative stress is basically what happens when you have imbalanced metabolism in the brain or when there's too much inflammation. So basically it's damage. You get damage and you require antioxidants to keep this oxidative damage under control. So we need more glutathione. We need more superoxide dismutase. These are antioxidants that our body produces. We need to actually try to help support that production. I want to mention that paracetamol, which a lot of people use when kids get sick, is actually an oxidant, is a strong oxidant. And it's neurotoxic to babies, and it probably contributes to autism. When you have oxidation of the mitochondria, get damage to the mitochondria, the cellular energy declines, and then more inflammation happens, like I mentioned before. When you have proper intake of nutrition, phytonutrients, and have the patient exercise or move, it's going to also help with oxidative stress or help regulate oxidative stress. So I came to the conclusion, and many people have come to the conclusion, that autism is mainly triggered by a stressful environment. Basically, the environment is highly imbalanced and just causes too much stress. So we actually destroy the microbiome. We overactivate the immune system. The kids are actually functionally deficient in nutrients. They don't eat very well, but also because they're inflamed, they just don't have enough nutrients to take care of that. And I'd like to add another thing, is that they actually have problems with detoxification. When you have inflammation in the body, there's a buildup, but also we're assaulted daily by like chemicals and smoke and stuff raining from the sky, stuff we breathe in, and stuff in the water. So it accumulates inside our body. So some nutrient deficiencies that are noted in autism are deficiencies of certain minerals such as zinc and iron, and deficiencies of B vitamins like B2, folate, and B12, and even thiamine. Children with ASD often have like restricted intake of many foods, and it's probably for a number of reasons. Probably they have food intolerances. And so when people have done studies on nutrient deficiencies, it's interesting that it's not consistent around the world. So it really depends on where the study is done. So here are some other things we've learned, is that we should remember as well, that when you have excessive oxidative stress, it actually raises the risk of autism, and it's related to autism pathogenesis. When you have oral dysbiosis, it also contributes to brain inflammation, and medication use will lead to dysbiosis as well. Also, if we eat a restricted diet, we're not feeding a variety of beneficial bacteria that we would benefit from, that will also calm down the inflammation of the gut. So by increasing the intake of good bacteria, by increasing the intake of phytonutrients and fiber, especially soluble fiber, that would help with that. So preventive actions, first of all, during pregnancy, the mother and the parents actually should practice good hygiene in general, and avoid anybody who has infections, avoid acquiring infections, probably avoid medication use if possible, minimize stressful situations, avoid vaccines if possible, and ingest a healthy plant-based diet. They should also breastfeed the baby for several months at least, and allow the child to be basically exposed to the environment and a good variety of bacteria and so forth. Not to take I don't mean exactly to take the child to a daycare, but I think that being outdoors would help. So we should also practice caution when giving the child medications in early life, such as giving paracetamol, NSAIDs such as ibuprofen, and antibiotics. Also, we found that early introduction of cow's milk protein and wheat protein, which are harder to digest, more difficult to digest, will lead to dysbiosis and inflammation of the gut. We should minimize exposure to chemicals, of course. Avoid exposure or intake of aluminum, if possible, in food and drink, because this has been shown to actually cause a leaky gut and increase inflammation in the gut. We should consider delaying, reducing the number of vaccines a child gets when they're very young, especially the first hepatitis B and the MMR vaccine. This has to be studied. This needs to be studied, but I'm just going to put the idea out there. But MMR vaccine has shown some association with gut inflammation, and I don't believe everything I hear in the media. So take care to also reduce stress and conflict in the first years of life. And diet, like I mentioned, maximize like phytonutrients if possible, and prebiotic foods, because that nourishes beneficial bacteria. Probiotics can be very helpful because they are anti-inflammatory. The probiotics do not stay in the gut very long, though. They basically, once you stop the probiotics, after some time the effects will wear off, like any other medication. So the usual probiotics that people have used are composed of lactobacillus and bifidobacterium species, but there are some others that we should probably consider as well, such as the Saccharomyces boulardii, which is a beneficial yeast that's also been shown to decrease gut inflammation. And there are so-called spore biotics. They're being used a little bit more often now in autistic children and just people in general who have gut inflammation. But spore biotics are composed of bacillus species, which are actually spores of those bacteria. They actually seem to be even more powerful than all of these. So all these other ones, the lactobacillus and the bifidobacterium. Some supplements. So I know we can't use all of these things, but we should consider using supplements in certain cases. We were talking about omega-3 fats, and I agree. I mean, fish oil and omega-3 fatty acids I think would be very beneficial in many children, and they will reduce inflammation not only in the brain but in the gut as well, and help the gut to heal. B vitamins such as B6 and B12, coenzyme Q10. This actually is an antioxidant, helps the mitochondria work better and generate more energy, also decreasing inflammation, decreasing the excitotoxicity in the brain. Zinc will do many things. It's good for the immune system, which we need to actually get under control in the gut, but also necessary for antioxidant functioning in the body. Magnesium, vitamin D, and probiotics are all important. So vitamin D, I'd say I should mention vitamin D. It's probably best to get it through sun exposure, through moderate sun exposure. But vitamin D is so important because it does so many things. It actually helps the immune system work normally, but it does like so many other things. It helps heal the gut especially, so it brings down inflammation. And basically the pathogenesis will be counteracted very well if the vitamin D is at an adequate level. But also I just want to mention that vitamin D needs magnesium to work well. So if you don't have enough magnesium, vitamin D won't work well. And then there's a few other things that we can consider. N-acetylcysteine to decrease oxidation in the body, decrease inflammation. There's something called N-acetylglucosamine, basically glucosamine, type of glucosamine that's been shown to help heal the gut lining. And even digestive enzymes can be beneficial to reduce dysbiosis. And then there's glutamine. I mean, there's L-glutamine and collagen, which help heal the gut lining as well, because they give the body components necessary to build the gut lining again. And we can consider like herbs such as like ginkgo biloba and deglycerinized licorice. and berberine even. These are herbal products that actually help reduce inflammation in the body, help improve gut functioning, and decrease leaky gut. And then in recent years, there has been interest in the use of fecal microbial transplant, which is like using feces from a healthy individual, which contain over 1,000 varieties of bacteria at a time, compared to probiotics, which contain maybe 10 to 20 types of bacteria. But this contains like 1,000. And so it's been shown beneficial in gut diseases such as Clostridium difficile, colitis, and inflammatory bowel disease. And now there has been a recent study that's been using a protocol called microbiota transfer therapy in autistic children. And what they did was that they gave the children 2 weeks of an oral antibiotic that killed the Clostridial species and all the gram-positives, oral vancomycin. And that was followed by a one-day bowel cleansing. Basically, they just flushed the bowel out. And that was, the child didn't eat anything that day. And that was followed by an acid-reducing medication with daily intake, it's like per rectum and orally, of something called a standardized human gut microbiota, which is basically feces from an individual which has been tested to be free of, to be healthy, basically. So after doing this every day, giving the kids this standardized, basically human gut microbiota every day by mouth for 8 weeks, they had an 80% improvement in GI symptoms at the end, but they also had improvement in their behavioral symptoms. So the kids had improvements in their behavioral symptoms. I didn't really get a number on that, but they had significant improvement in the behavioral symptoms. And even after it stopped, the results persisted for another 8 weeks at least, and that was the end of the study. So that's the end. Yeah. Okay, thank you.
Well, thank you very much, Dr. Yai, for your excellent information.